when infertile couple come to our clinic, I feel history taking is very, very important because we have to spend some time, we have to listen to their problems and see their reports. First of all, I insist couple to visit the clinic, both husband and wife, because 50% of the problems are related to husband and 40% are related to woman and 20% are related to their combined problems. And age is one important factor. It has a lot of impact on fertility. And 23 to 30 is the right age for fertility to conceive. And once they reach 35, it is the cutoff point, almost 50% decline in fertility. In this present era, majority are spending their time, crucial years in their education and career, and then after 30 to 35 years, they come to infertility clinic. So that's a harder time for us. So they have to undergo a lot of investigations and a lot of procedures. Then coming to the investigations, apart from the basic routine investigations, some screening tests for HIV, hepatitis and VDRL are important, and a detailed examination of a patient, especially her weight, that's obesity, is another factor which affects the fertility, and some hormonal imbalance, the examination of breast, thyroid gland and secretion, and her excessive body weight. All these things matter to fertility. Then the special investigations are transvaginal sonography, which is an important tool in a fertility clinic, which detects some uterine pathology. She could be having a fibroid, polyp or endometriosis or ovarian cyst. All can be diagnosed in a transvaginal sonography. Then coming to the tubal evaluation, we routinely do diagnostic hysterolaparoscopy. The laparoscopy is a small scope which is introduced through the navel, and it's a direct visualization of the entire pelvic organs. You can see the uterus and any tumors and the tubes, and at the same time we just put the dye from below and see for the tubal patency. Hysteroscopy is another equipment. It's a scope put inside the uterine cavity. You can diagnose and see any problem in the uterine cavity. She may be having septate uterus or adhesions or small polyps. And the one more advantage of this laparoscopy is it's a daycare procedure, and it gives accurate information, and it is diagnostic as well as therapeutic. That is, if we detect any problems, it can be solved at the same timing. Then after complete evaluation, if there are some hormonal imbalance is suspected, then blood test for hormones is very, very important, which gives a clue about her ovarian function, which is important. Male gamete and a female gamete are important for the conception. So after all the evaluation, we come to a conclusion and we diagnose a patient, and the male factor is evaluated by a surgeon, general examination, and one important investigation is semen analysis. It gives idea about the sperm concentration and motility and about the morphology. And in a suspected cases, we do hormonal evaluation and color Doppler, and sometimes there may be total azoospermia, that is, we don't see the sperms in a semen. So in such cases, there are two aspects. There is a primary testicular failure or a secondary cause. If there is a primary testicular failure or testicular atresia, we can't do anything. We have an option of using donor sperms from the semen bank. Then coming to the procedures, IUI is the commonest procedure. The meaning is intrauterine insemination, done for the poor semen quality, provided her tubes are, at least one tube is functional and patent, and it's a proven ovulation. But the results are almost just 15 to 20%. You can do 3 to 4 cycles of IUI. If it fails, then there is no point in continuing the same. We have other procedures, that is IVF, which is mainly indicated for tubal block. Actually, IVF means in vitro fertilization. In the natural course, tube is a site for fertilization. When the tube is diseased or blocked, the same tubal function is done outside the body. That's in an IVF laboratory. The steps, the indications are blocked tubes and poor sperms, and also unexplained infertility and failed IUI 3 to 4 times. The steps of IVF are: first is superovulation, and we start injection from second day of the cycle to increase the ovulation, superovulation. Then we do the monitoring, and once the adequate size is attained, we aspirate the follicular fluid, and in the IVF laboratory, it's a small ultrasound guided procedure. And next to the pickup is a IVF laboratory where the gametes are collected and they are put into the dish and put in an incubator. Whole tubal environment is created in the IVF laboratory. So next day check for a fertilization, and the embryo is formed in the laboratory, and that embryo is transferred into her uterus. And 15 days post transfer, we just give the pregnancy support, and confirmation of pregnancy is done on the 30th day. If IVF fails or the poor semen factors, we have a procedure called ICSI, that is intracytoplasmic sperm injection. A single sperm can be injected into the cytoplasm of the oocyte and thereby get the fertilization. The rest of all the steps are same for IVF and ICSI. They have a better result, and ICSI has got almost 50% of result, and IVF has got 30% of result. Nevertheless, we can't assure that we are giving a 100% result. So it is most rewarding, especially the ICSI, when there is a poor male factor. We have one more advantage, that is when there is a ovary has, in case of premature ovarian failure, when she's not producing her eggs, so we have an advantage of using donor egg and mix with the husband's sperm, make an embryo, and that embryo is transferred to her wife, so she can become pregnant and she can deliver a baby with a donor egg. So nowadays we are getting lots of premature ovarian failure. So this is the most advantageous procedure. And ICSI is one more. And one more. Because of the older age, we are getting there are many side effects, like getting more abortions and aneuploidy, that's a chromosomally defect child. So what we can do is, after the IVF, we can just test the embryo and transfer the embryo into the uterus. So it is called PGD. So pre-implantation genetic diagnosis or genetic screening. So it is indicated in elderly age group and family history of birth defects. So it is a very rewarding procedure, so that we can reduce the anomalous baby. So all are happy with the IVF or ART procedures collectively. It's a great boon to infertile couple. During IVF, if we get extra eggs and extra embryos, we can always freeze the extra embryos. Usually we transfer only 1 or 2 embryos in order to avoid multiple pregnancy. That's one of the complications which we had earlier, but nowadays we are restricting to single embryo or 2 embryo transfer. Remaining embryos are freezed, and in a subsequent cycles they can be used for the same patient. And one more thing, if we extend the culture on up to blastocyst, the results are very good, pregnancy results. It jumps from 30% to 50%. So for more information, please subscribe our YouTube channel.